And we now talk to health spokesperson Eric Domingo. Good morning. Thank you for taking our call.
Hi, good morning, Ria.
Okay, sir, again, just to clarify, ilan na po yung cases at ilan na yung namatay because of measles?
Oh, well, all over the country now, I think we have more than 2,000 cases. And we've had deaths. In San Lazaro alone, we've had 55 deaths in January.
Okay. Now, some hospitals here in Metro Manila are dealing with a huge number of patients with measles. How is the Department of Health dealing with that? And are there enough beds and enough supplies to treat these patients?
Well, yes, right now what we're trying to do is refer patients to other hospitals so that we can have a network and try, the less complicated ones to bring them to the hospitals nearer to where the patients live. We're also coordinating with the Philippine Red Cross in the possibility of setting up like temporary tents, like hospital-like tents, if we need to admit more patients at San Lazaro.
Okay, does the Philippines have enough of the vaccine to vaccinate people who want to be vaccinated and need to be vaccinated?
Oh, yeah, we do. We have enough supplies because every year the Philippines buys enough vaccines to cover the whole vulnerable population. And this year we ordered more. We ordered extra doses from UNICEF because we know that we have some defaulters from the past years and we want to vaccinate them too. So we have enough supplies for them too.
Okay, so just to be clear, we now have 5 regions with the measles outbreak. That's Metro Manila, Central Luzon, Calabarzon, and the Western and Central Visayas. How many more regions are being monitored by the DOH?
Where we're also, right now, we're watching Region 4B, Mimaropa, Region 1, Region 5, Region 10, and Region 8. No? There are some cases also in Region 12 that we are watching, but as of now, the 5 regions really have had our outbreak response system activated, and our health workers are going in the communities looking for more cases and, of course, vaccinating the children between age 5 months and 5 years.
Okay, sir, going back to what you were saying earlier about the number of cases and the number of deaths, I just want to clarify. You said there are over 2,000 cases. That's nationwide. And you said...
That's nationwide, yes.
Okay, and you mentioned 55 deaths. Is that just in a particular area or also nationwide?
That's in San Lazaro. Nationwide, I think we have, for example, in Calabarzon, we had 9 reported deaths. In Region 3, we had 4. In Region 6, 3. And in Region 7, 1 fatality.
Okay, so that's about over 70 deaths now, correct?
Yeah. Yes.
All right. Now, some parents are saying that aside from the dengue scare, some of them do not have immediate access to measles shots. You already mentioned there are measles shots available in all health centers. Is that correct?
Yes. However, of course, there are some areas, we understand that there are some areas that are really geographically isolated, where the health centers may be far from the families and transportation might be difficult. So in these cases, the health workers will have to go to the faraway communities and bring the vaccines there themselves.
That's right, because we've heard that some local health workers are also now going house to house. Can you tell us more about this campaign?
Yeah, maybe 10, 20 years ago, children were lining up to have themselves, the parents were lining up to have their children vaccinated. But now we have to just be more active. If there's some hesitancy, we go to the houses and then explain patiently to the families what the benefits are, what the risks are for vaccination, and how good it is for their children. And, just taking a little more time and a little more effort to explain it and hopefully, get that consent to have the children vaccinated.
That's right. It's become this so-called forgotten disease. People don't see it, so they don't feel the need to get vaccinated against it, right?
Yeah, and then this is what can happen, because measles is such an easily transmissible disease. You get infected very, very quickly. So once you have a few cases in the community, you have to contain it immediately before it gets out of hand.
Now, this recent outbreak has prompted your department to advise vaccination to babies as young as 6 months old, when usually the age for that vaccination is 9 months. Is this safe enough, and how can the DOH assure the public that getting vaccinated is safe and they don't have anything to worry about?
Yeah, it's safe, because we usually give it at 9 months old, because assuming that a mother is vaccinated or had measles and has antibodies at birth and during breastfeeding, they can give the antibodies to the children, which usually protects them until 9 years old, until 9 months old. However, since many of the mothers themselves, the young mothers, are not vaccinated, we're seeing children who are unprotected at birth. So what we do now is give the vaccine at an earlier age, at 6 months, which is a safe age. And, they're not sure if they've had that vaccination, we can give it again. There's really no danger to having an extra measles vaccine.
All right. Thank you very much, Health Spokesperson Eric Domingo.